Welcome, I'm Dr. Emily Sine of CBS News. Joining me is Professor Robert Edwards, Professor Emeritus at Cambridge University. We're talking today about his amazing scientific career and how so many of the things he worked on early on have led to amazing breakthroughs and potentially even more amazing breakthroughs as time goes on. But I want to go back to the very early days when you first were working on IVF. So much of that was controversial. How much of the controversy that's going on today brings you back to that time? Is it almost like a flashback for you when you hear about the controversy today in this country over things like stem cell research, human cloning, that sort of thing?
Well, in point of fact, President Bush's dilemma about stem cells that ended in him purchasing stem cells actually arose in my clinic. It was called Bourne Hall in Cambridge, when we were growing human embryos for infertility care, but we're taking 1 or 2 spare ones for making stem cells or for using methods to diagnose genetic disease in those embryos. And we had a meeting and we decided we could not use embryos from our patients for research. It wasn't just. The embryos were not chattels. No one could give them away. You know, no one really. You can change the law to enable us to use embryos without penalty, which is how every advance in reproductive medicine has proceeded. But to do the work, the person in the laboratory, myself, or many Americans today making stem cells, or British people making stem cells, have to make their own individual decision to go ahead. That is the basic of the ethics of scientific research. And we felt, all of us, that we could not take embryos from our patients to do this research.
Do you still feel that way?
I still have these complex ethical difficulties within me. I don't usually formulate them because we've passed many of them, of course. IVF is very well established by now. Pre-implantation genetic diagnosis of diseases is now wonderful. The arguments we're having there is about the late onset diseases such as Huntington's disease and these tumor suppressor genes which will mutate so the person gets all the tumors. These are the problems today. But all these things have now come into truth, so the ethical decisions are now way past me. But they still live with me, I'm afraid to say. They're still there within me.
Did you support President Bush's decision, or did you think it was not the right thing?
I think it was a compromise. I think we understood the compromise because he had become clear out about a related issue, which is abortion. Because, of course, what you are talking about is how do you value fetal human life? This is the fundamental question that faced us on the very first day when we added sperm to eggs to fertilize them. How do you value the human embryo? How do you value the human fetus? And this, of course, has divided nations, including yours and including mine. So, inevitably, these problems are still there. In the end, he's agreed to buy stem cells from people making them in private clinics here or abroad. I think that should relieve the immediate problem for the research. I think so. I think it's a compromise of ethics because he relies on other people making the personal decision to go ahead to make them and compromise their own ethical situation, and he pays money to get them, you see. It's not a happy decision, and I hope one day he will go the full hog and say we must do embryo research. I think so. I hope he can go that far.
How does it feel to be really at the beginning of so many things that have led to so much positive treatment of infertility and yet so much moral and ethical conflict? They call you the father of in vitro fertilization. Without your early research and your manipulation of embryos in the laboratory, we certainly wouldn't be talking about stem cells or pre-implantation genetic diagnosis or any of these things. How does that feel as a scientist?
I think I live in a permanent high state of excitement. It's a nuisance because when I get home, it doesn't go out of my head and it dominates life. I'm not the only one. I'm sure the other winners of the Lasker Award are exactly the same. But When we started these ideas back in the 1960s, just by chance, my career, my PhD, had led me to work on mice reproduction, in order to try to change the number of chromosomes in the embryos. That was my genetics. And from that time onwards, I've been in those three fields: genetics, reproduction, and ethics. My professor in Edinburgh taught us ethics of science. It was wonderful. And I knew when he was teaching me with these ideas in mind that everything he taught me would be valuable, and it's proved right. So as we went along, we knew, first of all, we could probably get embryos if we could get the mature eggs in vitro, if we could fertilize them in vitro and grow the embryos. We could probably use those embryos to diagnose genetic disease, and indeed in the rabbit egg, we sex the embryo by taking a small piece of it and sexing it. We tried in human, by the way, in 1971, but we had no DNA markers in those days. Remember, this before Watson and Crick did their stuff, you know, some of these...
So you could not sex human embryos at that stage?
Well, the rabbit had a little marker in its nucleus that showed it was a male or a female. The human did not. Or else we'd have introduced the sexing of human embryos in 1971. This took another 18 years before Alan Handyside, who's one of the young students we had in Cambridge in these fantastically wonderful years of research, with 20 or 30 students around. A wonderful time for a teacher, by the way. And then, of course, it came true then. Today, all these methods are working. They're all beginning to show. And stem cells are actually the last one to get started.
In your book, A Matter of Life, which is the tale of how you and Steptoe got together and really worked for many, many years to perfect IVF, you say that when you first saw the human embryo dividing and forming in the Petri dish, you then went outside and looked at the moon and the stars, and you saw all the wonder of this. But did you know at that time, how prescient were you? Did you know stem cells at that moment? Did you know pre-implantation and IVF would all come true?
We found the human blastocyst, I'm speaking from memory, in 1971 or 1972. We did stem cells in the rabbit in 1963. We did the sexing of the rabbit embryo in 1968. We did fertilization in vitro in mice about the same time. We weren't the first to do in vitro fertilization in the mouse. So we had all these techniques in animals behind us. And when I got to Cambridge, I had lots of young students who were looking for jobs to do. And so they helped us in some of these areas. But if they didn't, we had their ideas coming in. So the only ethical issue that we did not bother to attack was cloning. Because we didn't think I thought it was a waste of time. I used to say I've never met anybody worth cloning, was my answer to that. So I never bothered with cloning, you know. And even today, I think there are more things that I should be doing than cloning. But all the other ideas were apparent in 1968 or 9 and became true after those years. Remember too that if you talk about human stem cells, you could not get blastocysts except by growing them in vitro. Now, we could get blastocysts in 1972, but we didn't know if they were normal. We had to put those blastocysts into a mother and get babies. So the birth of Louise Brown also signaled the birth of human stem cells.
Well, that brings up an important question. Those early attempts at IVF, many of them failed. Were they genetic abnormalities? Was it hormonal abnormality? What was it about those early attempts that wasn't quite right? And how did you hit on it with Louise Brown?
It was entirely our fault, and it was due to an ethical mistake. We knew in those days that you took an egg from a woman who'd been stimulated with hormones and fertilized it and grew it to an embryo, that her menstrual cycle was distorted. The second half of her cycle was abnormal and foreshortened, and it would not support a pregnancy. So we had to give support to our patients to sustain any pregnancy after transfer. Now, we knew the hormone to be used was progesterone, and an American scientist had shown how this would be needed for 8 to 10 weeks, because the ovary normally fulfills that period. Now, the ovary had been shot to pieces by the hormones, so it would not produce progesterone. Now, we would not give progesterone because you give it in oil and you have to put it into the backside every day for 8 to 10 weeks. And we decided that we would not cause scabbing in our patients because we couldn't offer them anything. There was no baby. You could do it today because you know you'll get babies, those who didn't. So we chose a different hormone, which was supposed to save threatened abortions. It's a hormone called primulot depot. All your doctors looking at this program will know exactly the compound I'm mentioning. And we believed this is what we should use. So I was transferring embryos. Then Patrick was injecting primulot depot, which turned out to be an abortifacient. And it was only after 3 years when a friend of mine developed an assay for early pregnancy, the assay for technical reasons for human chorionic gonadotrophin, and I'd saved all the samples of blood from our patients. I sent them to him, and he wrote back and said, Bob, at least 5 of your patients have had an early pregnancy which has been aborted. So I knew then the reason why I hadn't got pregnancies was our ethical decision, and that taught me a lesson. Be careful about letting ethics interfere with science and medicine. Sometimes in these fields you have to make a decision. You have to follow that decision. And if you vary for ethical reasons, you may be causing a lot of ill health in your patients. Failure to bring new treatments could help more people. You may be compromising the whole of your work. That was the lesson I took from that period, in addition to the fact that all my enemies and all my opponents had a field day because they knew we were transferring embryos and getting no pregnancies.
When you were working on IVF in the early days, certainly there were other people out there trying to do the same thing. Did you have a sense of competition? Did you know, were you working towards the crescendo of creating the first pregnancy? Was that in your mind?
It's always been astonishing to me that to me and to Steptoe, we had to go to work on the human. Remember, I'd never touched a patient in my life, and he'd never done any science in his life. But we both knew we had to team up to do this work. And we agreed, before we touched a patient, that we would stop if we thought any damage had been done to the mother, the father, or the child. But we would not accept religious objections that weren't defined, or political objections that weren't defined, or personal insults, which we got in plenty. And that's what we did. We kept going. And we never hit a phase, except this ethical situation I've just described, when we thought we were doing harm to our patients. Never. And I never thought the embryos would be born abnormal, even though famous people, including Nobel Prize winners, told me that I would have to do infanticide on the babies. We've never done infanticide on a single child. There's no need. We have the same problems in IVF as you have in normal, natural conception. Low success rates in IVF, low success rates in natural conception. Couples have about 4 cycles to get 1 implantation. We can't change that. That's in the human embryo. And today, I'm looking at the reasons for these things, because the human embryo is related evolutionarily to the other embryos, but it's changed along the line somewhere.
Was it the work in mice and other species and the success in that gave you the confidence to say that you wouldn't run into those problems that so many of your critics were quickly leaping on you at the time?
We had, I had done many transfers myself of mouse embryos. I was in touch with the groups who'd done them. We had some awful shocks. One was done, we're doing the diagnosis of genetic diseases in the rabbit embryo as a preparatory to the human side, and we found one of the fetuses was what we call anencephalic. And we thought, we've done that by dissecting the embryo. But we went back to the strain of rabbits we're using and examined the litters and found that this was a gene that was segregating in that rabbit population, anencephalic.
Nothing to do with...
Nothing to do with IVF, nothing to do with dissecting cells from the embryo. And we had 2 or 3 times like that, when a report came out of defects in the eye, I remember, in the rat. It wasn't my work, it was a friend of mine called Chang, who worked up in New England. And then he wrote and said, Bob, don't worry, it's in the strain of mice. That was out as well. So we went through all these periods, and we would have stopped if we thought we were doing harm, but we never thought we were doing harm.
You've had an extraordinary career, because not that many scientists, I don't think, can claim to master really several disparate areas of inquiry and bring them all together to create a clinical benefit like IVF. In the very early days, did you follow things as they unfolded? Did you always have in your mind a goal? How did you take all these areas of science and bring them together, of course, with Steptoe as well?
Before I met Steptoe, I had to do two things. I had to get oocytes from the ovary, which were not ready for fertilization. Let's call them unripe. It's a pretty good description. And had to ripen them by some means in culture. That took 5 years. And then we had to fertilize them, and that took another 5 years. And then, when we knew we could do that, then we had to move to the patient and stimulate it with hormones and collect her own eggs from her ovary 1 hour before they ovulated. That was the timing. But we were confident in our work that we could do that, and we did.
Did you know were you saying to yourself, I want to take unripe eggs and ripen them in the Petri dish? That's my next goal. Was it with something bigger in mind, or were you just taking each step as it came and trying to work through each problem as it presented itself?
Well, we knew all about stem cells, pre-implantation genetic diagnosis, chromosome anomaly. We knew about these in our work in animals and from published work on human beings whose fetuses were being aborted because they were chromosomally abnormal. So we knew all this work, and the targets were there, and I knew every step we had to take, and every step was occasion for wonderful rejoicing. The birth of Louise was perhaps not necessarily the last of these stages. So we had a series of high points. Well, I remember when we saw the first human blastocysts. They were beautiful in vitro. They were light and floating, and I remember going home overjoyed by this. And 2-3 years later, a human embryo went to day 9 in vitro. Well, that is when the blood tissue began to form. It meant that the human embryology could go through 9 days. We could get wonderful news. But of course, we had to balance it all out ethically. What right did we have to do it? I felt I had a right to go to the blastocyst and transfer it into the mother to get a child. But going on was purely research. These are sort of problems that faced us. And when we opened our big clinic in Bourne Hall after Louise was born, all these things had to be codified in law and in legal contract with our patients, and that took an immense amount. Every letter, every word had to be in the right place in the contract. I'm not a lawyer, but I could see them doing this. And we had to write these contracts that were legally tight on both sides, that they were fair on both sides, and that we could follow them. So not only were we doing the research, we also now had to work with patients and with an advancing science, which is what it was, into the modern ethical status of nations all over the world. And today, it is marvelous to travel around the world and see that most of them have accepted our original stance, and they do it in their countries. It has been a worldwide agreement that what we did was right, which is also marvelous.
The story is told that you attended a lecture given by Dr. Steptoe, Professor Steptoe, and he was talking about the laparoscope. And this light bulb went off in your head, and you met with him afterwards, and that's how you two began your collaboration. How much did you lend to his side of the equation, and how much did he lend to your side of the equation in the scientific pursuit of IVF?
Well, the story you've got is not quite right.
Okay, correct me.
As a student and as a young doctor in Cambridge, I always believed in reading in the libraries, you know, wandering through and reading the books. And one day, and I'd been working with Howard and Georgiana Jones in Hopkins. We knew we had the eggs right. We had to collect them from the ovary. And I one day went down and read the Lancet in the library of my department. And there was a paper by Mr. Steptoe, who said that with his laparoscope he could get access to the oviduct. Now, if he could get access to the oviduct, he could get access to the ovary. No question. And so I phoned him. And it became clear I would have to work in Oldham, because the patients were there. There were none in Cambridge. That was nearly 200 miles from Cambridge. I had to go back and forward. And for 6 months I hesitated, because I would have to leave my family and my wife, and in the end this happened. But finally we rang again, and we said, let's meet in London at a meeting. Where I was lecturing in one room and he was lecturing in another room. I gave mine, went next door, and I heard a very famous British gynecologist get up and say he had been using the laparoscope and he could not see anything at all down it. It was totally useless. There was an explosion from the back of the room, and this little short man stood up and said, nonsense, nonsense, I have photographs. And he showed photographs, and I said to myself, that's got to be Patrick Steptoe. And it was. Could I say a word about Patrick Steptoe?
Please do. He's so important to the...
He's so important. Without standing together, we could not have done it. No question. Without his laparoscopy, I know it's been superseded today, but without it at those times, it would have been impossible. Also, he was hounded, like I was being hounded, for his laparoscopy, because people said it was dangerous, because anomalies. And when I met him, he'd done 1,000 cases, by the way. So he did that. And when he did that, what he actually did was to make the field of endoscopy. Endoscopy is passing light down tubes, down blood vessels, whatever you say, into knees. He was doing endoscopy in relation to gynecology. And so his laparoscopic gynecology was the beginning of the breakthrough of endoscopy. Today, in England, it is emptying hospital wards, because you can cure people in a day, whereas before you couldn't see what was wrong and you couldn't cure them in a month. This is what Patrick did. Patrick did IVF and endoscopy, and I think he should always be remembered for those two things.
It was superseded as far as IVF goes, but of course they fix 1,000 things via the laparoscope now. So originally it was just for infertility or for tying tubes or something.
Well, he once showed me a liver biopsy he'd done with a laparoscope. So, and he also showed me the treatment of endometriosis by the laparoscope. So it was in his mind to go beyond infertility.
Did he help you in your thinking in the laboratory, and did you help him in the clinic?
I think what he did for me was put me in medicine without a medical training. I just followed him around. So what he did, some things I didn't agree with him, and he didn't agree with me. You know, we had our ups and downs. But he taught me how to handle myself, how to approach patients, how to work with patients, what to say at the right time and what not to say at the wrong time, you know. I think what I did for him, I took his work and put on a ruthlessly strict scientific basis. All the papers we wrote, I had to write. He didn't write scientific papers. He wrote reports that were published in Lancet and BMJ, but they weren't scientific. He was practicing doctor. He was a practicing doctor. He's a first-class surgeon who was trying to change the world and has changed the world in his own way. And together we could change it another way, and we did it. I think the deal was a totally fair one. I have no complaints. I think it's been wonderful, and I am really sorry that he's not here today to stand and accept the Lasker with me.
In a way,
I really am,
yeah.
Yes.
You're winning the basic clinical award. You could probably win the basic bench scientific award. But in a way, it's a tribute to him, too, because it's about clinical medicine. And
yes, he should be standing with me today, because it is a clinical award. And I would have done any clinical award without Patrick Steptoe. I must also pay tribute to my 3 or 4 other doctors in Britain who helped me in those early years. I won't mention the names, but Patrick was the one who, in the end, had the knowledge, the skills to carry it through.
maelstrom when Louise was born was pretty extraordinary. Probably a lot of people, unless you were around at the time, don't remember what that was like. That was a tough time for both you and Steptoe. Personally, what was that?